Tattoo trends tend to come and go, but there's one popular trend happening right now that could cost you more than money. It could cost you your life. And that's having large pieces placed under general anesthesia, using several artists working at the same time, and taking upwards of 5 hours in one single session. While it might seem a great idea to have a large, painful tattoo placed when you are completely unconscious, unaware of what's going on, and not feeling 1 ounce of pain, it might seem like a great idea. But it's got some risks. And today, as a board-certified anesthesiologist, I'm going to tell you how to avoid those risks. So if you want to do a large tattoo under general anesthesia, following my guidelines is going to significantly make it safer for you. So let's go. First, we have to look to see if you're a candidate at all. If you're morbidly obese, have insulin-dependent diabetes, especially if you're on an insulin pump, have uncontrolled high blood pressure, have severe gastric reflux, or any anatomical concerns, including coronary artery disease, well then, you're really not a candidate for this type of elective procedure done under general anesthesia for that period of time. The next thing you're going to have to look at is who is going to be giving you that anesthesia. Preferably, it'll be administered by a board-certified anesthesiologist. That is a physician who's gone through 4 years of medical school and 4 years of intensive anesthesia study. And then they work for approximately 1 year before they become fully board-certified. The next would be a certified registered nurse anesthetist. That's a nurse who's taken some anesthesia training plus respiratory therapy training. And depending on what state you're in, will depend on if that nurse anesthetist can work independently or do they have to have an anesthesiologist there with them. Those are the only 2 people you should trust to administer the anesthesia for this procedure. I've heard of a few dentists doing it, and I've heard of a few non-medical professionals doing it. It's extremely dangerous. So only an anesthesiologist or a CRNA. Next is where is it going to be done? Ideally, it will be done in an operating room at a hospital that's fully staffed and fully equipped to handle any type of medical emergency. The next would be an outpatient surgery pavilion. However, the problem is, depending on what state you're in, I'm in New York and they're very, very tough. I doubt that the tattoo artist is going to get credentialed to allow them to admit a person into those operating theaters. You see, the surgery center in the hospital is legally bound to what happens to that patient in there. So they're going to scrutinize the person bringing in a patient, normally a surgeon. So the odds of a tattoo artist being able to utilize an operating room in a hospital or an operating room in a surgery center is going to be pretty low. Now, in your state, it might be very different, but in New York, it's going to be extremely hard, which means it leaves 3 other places: some doctor's office, a tattoo parlor, or a house. And those are not ideal. And I'll tell you why. They're not going to have the proper staffing. They're not going to have the proper equipment. It's not going to be the proper environment to try to resuscitate a patient. God forbid, worse comes to worse and you have a cardiac arrest on your hands. So try to have it done at either a surgery center or a hospital setting. Now, is that person going to be using the standards of care set by the American Society of Anesthesiologists? You'll be surprised how much monitoring goes into every surgical procedure. It's recommended that there be a continuous EKG monitoring displayed on a monitor. Blood pressures should be taken every 5 minutes at the minimum. You should have a continual heart rate monitor, an oxygen saturation through a pulse oximeter to ensure that there's enough oxygen circulating in the hemoglobin. Preferably an end-tidal carbon dioxide monitor to see if you're exhaling enough carbon dioxide to show that you're breathing adequately. Temperature measuring should be done. Also, should somebody vomit or start to aspirate, Yankauer suctions attached to a strong suction canister. These things have to all be in place, plus provisions for emergency care. They have to have a crash cart. They have to have equipment and medication readily available to handle a sudden crisis. You see, anesthesia is 95% boredom and 5% sheer terror. And during that terror, that sometimes comes out of the clear blue. So your facility better have all the equipment to do a full resuscitation, all the medications to do a full resuscitation, staff to help out, because believe me, you're going to need plenty, and the overall facility to take care of the aftermath. So that's why those last three, a doctor's office, a tattoo parlor, and a house, really not adequate, and I would be very, very, very cautious. You have to also consider, what position are you going to be in? It's very easy if they were going to do a chest, arm, and belly piece, because you're going to be lying flat on your back. It's going to be very easy for that anesthesiologist to take care of your airway. But if that tattoo is on your back, and you're going to be in the prone position face down, as you can see, it's going to be a very careful body placement. You're going to have padding around your eyes to not put too much pressure on the eyes, or you could get retinal detachments and blindness. You have to have padding on the arms to prevent pressure points building up on the brachial plexus and nerves running down your arm, as well as the legs. You're going to have something under the chest and pelvis called bolsters, again, to avoid too much pressure on pressure points. And probably, if you're going to have a 5-hour procedure, something to avoid blood clots from forming. You see, general anesthesia is not sleep. Everybody says, oh, you're going to sleep. It's not sleep. It's a controlled state of unconsciousness, which means you're not going to turn and toss like you do in normal sleep. We move several times an hour. An anesthetized patient stays perfectly still, which means they're going to put pressure on pressure points, pressure on nerves, and have a risk of developing a blood clot in their leg that could kill them. So the facility should have something on the leg squeezing the calves every few minutes to keep blood flow going. Let's look at this case. Now, I chose this thumbnail specifically because they're doing everything right. That patient there getting tattooed is probably the safest that they could be. Let's see, we have a doctor at the helm. It says MD. I'm going to assume he's an anesthesiologist. To his right, he's got an assistant. Hopefully that will be a nurse or at least a CRNA. To his left, he's got the monitors. So that's very good. He might even have a full anesthesia circuit. It's not in the frame. The patient is on their back. They're in the supine position. The eyes are taped. That's going to avoid corneal abrasions. In other words, if the eyes stay open, the corneas are going to dry, and as soon as that patient blinks, they're going to scratch those corneas, and anyone who's had a corneal abrasion knows it is miserable. They have an endotracheal tube in place. That's that tube in his mouth going to his trachea. I can't tell from the picture. It might also be a laryngeal mask airway. In any event, it's taped and secure into place. There's a little tube on the side of it. That's a tube going into his stomach. That's going to continuously suck out gastric juices, significantly decreasing the risk of them vomiting. Looking at his head, it's under a good level of padding. There are shoulder pads as well. Under his arm, we see this pink egg crate. Kind of looks like an egg carton, doesn't it? That pink egg crate is putting a nice foam cushion under all of the nerves in his arm, in particularly under his axilla and in his elbow, where the ulnar nerve could easily be pinched off, leading to problems with moving your fingers and hands. So they're very well padded. I'm hoping there's something on the legs as well. The only negative I could say about this whole thing is that I can't tell if he was having an abdominal piece as well. It looks like they're working on the arm and shoulder. If they weren't tattooing the belly, I would have recommended a bear hugger. A bear hugger is this drape that you attach a large, kind of like a blow dryer to. And it fills that with warm air and it circulates over the patient and it actually keeps their body temperature up. This fellow here with his belly and chest and everything from basically his pelvis up is exposed to the room air. He's going to lose a lot of body heat. And when he wakes up, he's going to be hypothermic. He's going to be shivering, which means he's going to use up a lot of oxygen. And it's going to depress his immune system and could even alter some cardiac function. So the only negative I could say about this is hopefully there was some way of keeping this patient warm. Now there could have been a warming blanket under him. You can't see it in the picture. And that's different than a bear hugger. That circulates warm water through a bunch of channels, kind of like a solar panel, under the patient. But this guy was in good hands. Now, the second one I'm going to show, when I looked at this video, it was from a documentary. They did mention all of the key things that should be done. They mentioned the monitoring. They mentioned moving the patient around, preventing clot formation. Everything was good. The only negative I could say about this is when this case was over, and it was about 5 to 6 hours long, there was a little too much partying going on. That patient just woke up from a 5-hour procedure. I guarantee they're hypothermic, they're disoriented, they might even be nauseous, and all eyes should be on the patient at that moment. Not dancing around and holding the urine bag and drinking that urine. And if that was urine, I have to tell you, kudos, that is one wild surgical team. But that's my only thing, is that they looked away from the patient. Anesthesia is just like an airplane flight. The dangerous times are takeoff and landing, and in the middle, it's kind of just nice, maybe a little bumpy now and then with some turbulence. But the beginning and the end are critical. So in this case, they kind of looked away. They were having some fun. At least there was somebody holding the patient. And the other thing is, what are you going to do after this procedure? You've had anesthesia for 5 hours. And anybody knows that's had anesthesia like that, you don't feel so good. And they have him walking to the recovery area. That's really not good. The odds of him dropping his blood pressure are very high. And the odds of him going down like a rock, and if you ever try to hold a person who's unconscious, it's extremely difficult. It's dead weight. So the odds of him falling out of their arms and cracking his head on the floor are kind of high. So you're going to have to find out, where are you going to recover and how are you getting to the recovery room? Ideally, it would be a stretcher. You might find a wheelchair, not quite as good because you still might get nauseous, but I would never recommend walking a patient who had general anesthesia for that amount of time to a recovery area. So, if you listen to this and ask those right questions, you can have a large tattoo placed under general anesthesia and still be safe. It's when corners are cut that we end up with a lot of problems with anesthesia. As you noticed, when I was a little boy in the late 50s, you heard about people having surgery and dying. It was almost commonplace and people weren't even surprised. They'd say, oh, they died in surgery. Now you don't hear it so much anymore. It's because of all the monitoring, all the vigilance on the part of the team towards that patient. So if you follow all these rules and you're in good health, then you should be able to have a tattoo placed under general anesthesia and be just fine. I hope you learned something in this video. If you did, give me a thumbs up, click subscribe, and I'll catch you at the new video.